And we are live. Welcome to everyone. Today is a very special day. It's the last day before we kick off our live 2-day intensive workshop where Dr. Edward will be working with everybody, helping them build a roadmap, which is essentially your success roadmap to help you and your animals minimize that stress level. So welcome, Dr. Edward. Thank you very much. It's been a massive 8 weeks that we've been going deep into anxiety, and today is our last day before we start. So just want to give you a warm welcome, and let's really just kind of go deep into what people are going to be getting, and also mention we do have a free giveaway that we're going to be giving today.
Yeah, if anyone wants to jump in and enroll today, we've got a special intensive online kind of workshop that I recorded a little while back, which is all about using CBD, not only to help pets with anxiety, but talking about all kinds of different things with CBD. I reckon it's one of the most powerful, safest, most beautiful herbal medicines on the planet. I use it a hell of a lot in my practice. But before we get started, if you could all just say hi in the chat. How many people have we got live with us today?
We have 20 people that are on live with us right now.
Beautiful. Welcome, everybody. But say hi in the chat. Let us know where you're from and what pets you have. Love to hear where you are around the world. It's always really nice for me to get a sense of where everyone's living, when you get on these lives. Hi, Cheryl. Hi, Deanna. Hi, Laurie. Hi, Karen. And yeah, we are going to be digging into 2 days. It's a very intensive workshop. You're going to learn an incredibly large amount of information in the 2 days that we're going to spend together. Day 1 is all about understanding and preventing anxiety in your pets. We talk about understanding the complexity of what causes anxiety. Anxiety tends to be kind of multimodal, complex. Lots of things happen over a long time, nearly always, to cause anxiety. We're going to help you understand how your pet's anxiety is unique, because you need to understand, your pet to be able to tailor what it needs. Then we get into teaching you how to recognize anxiety signs. We go through the 4 phases of anxiety, kind of like red flags, subtle signs of anxiety. A lot of people miss prevention strategies, managing your pet's arousal levels, recognizing and managing them. And we talk about your role, because you have a big impact on your pet's anxiety, whether you know it or not. It's really important that we get you on board with getting committed to doing what you need to do to help your pets. Take you through some internal process that help you be calmer, which helps your pets. And then the really important thing, possibly the most important thing that you're going to learn, is that I'll be teaching you the whole energy body balance, relaxing touch live in the workshop. So you'll be getting your hands on your animals and learning how to use touch as a medicine to heal your anxious pets. So that's kind of day 1. Has anyone got any questions out there in the chat too? If you've got any questions about the workshop or anything like that, I'm happy to answer them. Do you have any questions for me, Isaac?
Yeah, well, how did you just came to my head just then, how did, like, being a veterinarian and getting into holistic medicine and then going deep into touch and anxiety and making that like as a specialty, how did you get into that, and like why was that like a foundation or something that's really important to you?
That's a really good question. So I first started off doing therapeutic touch hands-on work probably about 26 years ago.
Yeah.
I was about a year and a half out of graduated vet. I'd had an awful job and then left that job and was doing a locum job. And there was another vet came to town to work with some horses called Dr. Tom Ahern. Now, he'd created this way of mobilizing the vertebrae in horses' necks, releasing and freeing up restrictions and pain and tension in the neck. And he would get these horses that had a forelimb lameness that other vets would have nerve blocked, x-rayed, couldn't find any reason for the forelimb lameness. And he would then mobilize the neck, and the lameness would go away a lot of the time, because there's actually a nerve root compression, a little misalignment of the vertebrae and the nerve root gets squished and you get referred pain down the leg. Like, a lot of people get sciatica or they get numb, tingling hands. The same kinds of things happen with our pets. So I was just completely fascinated by this because at university, we didn't get taught anything about this kind of stuff. And immediately I thought, well, dogs and cats have necks and backs. So I started getting really curious and I started exploring more deeply with my hands and actually searching, really getting more specific and feeling deeper into the body. And very quickly, I realized that I'd been missing a whole lot of pain and tension. So I started off just working with the neck, focusing on the neck and back really, and looking for pain and tension there. But then I came across Temple Grandin's books. Now, she's an autistic woman who has become possibly the world's greatest expert on designing stock handling facilities, like, abattoirs, stock feed, feedlots, all that sort of yards, cattle yards for moving cattle through, things like that. She's got and when she was at school as a teenager, she was autistic and had tremendous trouble with social interaction, a lot of stress around anxiety around social interactions. And she went out to a cattle ranch, a cattle farm on her holidays. They had a squeeze crush. And she noticed that when this crush came in and squeezed tight on the cattle's body, the cattle's relaxed. So she went home and she built herself a squeeze crush out of some plywood boards with some padding on it. And she'd get in there and get this thing to squeeze and bring deep pressure into the body. And she found it relaxed her and helped her with her social anxiety. So then, it was probably, 5, 6, 7 years after I'd started working hands-on with neck and back pain. I see anxious animals all the time in my work, and I thought, well, how can I apply that? How can I transfer this deep pressure into a touch-based therapy? So I worked out how to do that through a particular kind of body work, which is one of the core things that everyone who comes to this workshop is going to be learning. And I found that it can be an incredibly powerful and rapid way to have behavior modification of anxious animals, because every time you use touch, these anxious animals are stuck over here in unhealthy arousal. Even when they're at rest, they're still baseline chronic low-grade arousal, which is not where they should be. But when you use the touch and you help their body come into relaxation, because it's a body level response, when you use the right quality of touch, the nervous system, the parasympathetic nervous system switches on, rest and digest, relaxation, regeneration. So every time you use the touch, you're teaching the whole system how to regulate into relaxation. So you're building the animal's regulatory capacity. So it gets better at being then able to bring itself into relaxation. And you do this enough times, and then once they start learning how to relax, you can then use this touch in the face of triggers. And suddenly you get an animal and when you do this with an animal with triggers, it's really quite almost amusing to watch, because I'll be working with them and you'll see they go, oh.
Yeah, I've seen one of your videos.
I can't relax. I can't. And you'll do more touch, and you'll see this kind of cycling like this. But over time, what happens is that they then learn, I can relax when the thing that I thought was scary was there. So maybe it's not so scary. So over weeks and months, they get the whole mental memory worry thing starts to reset itself as well.
You came up with like you got your 3 type of areas. I think you said there's 4 now. How did that evolve? And like you just when we started talking off, you like pre-arousal and then
the 4 zones.
Yeah, the 4 zones. How did you like come up with that? And like it kind of like has that's kind of like a real, and I guess it's a really easy guide for anyone that doesn't know much about like where they can kind of see or see where their animal is at.
I think when I did the fear-free certification, they had this kind of zones thing, and I've kind of expanded on it and refined it a little bit.
Yeah.
Green zone's happy, healthy, relaxed.
Yeah.
Then you have cool orange, which is happy, healthy, and playful and stimulated. Then you have hot orange, which you're getting into pathological levels of arousal. You're losing cognitive ability, the animal, and they tend to escalate when they get in that zone. When you get in the hot orange, they start to lose, they can't get back into relaxation. They tend to escalate into higher and higher arousal. Then you have the red zone where they've completely lost their mind and there's no one home. You've got a crazy dog.
What do you do with the crazy dogs?
Well, if you get a dog that really gets triggered like that, you got to remove them from the trigger, and you got to do
Yeah.
everything you can to help them relax. Now that's not something I can really tell you everything about here, but we'll be going into it in depth in the workshop. I'm just going to say hello to a few people. We've got Donna from Tasmania with a beautiful border collie. Larie's got an Akita. Deanna's mobile nail trimmer for pets and has many high anxiety dogs. You would love this kind of. You'll find lots of things that'll help you if you're, professional or just a pet parent. How much
Well,
does diet and essential oils play into therapeutic touch with anxious animals? Well, they're kind of different things.
let's
Catherine
just
says,
talk about that, Edward, for people that are in the professionals that aren't just dealing just with their dogs and they're having multiple dogs come in every day like a groomer. What do they do when it can take a bit of time with, like, different from the one-on-one owner where they have their own dog or cat and they can see the cues a lot easier. What about the
well,
professionals that are dealing with multiples?
well, I suppose part of if you're a professional and you come and do this workshop, you'll know better how and when to help people get the help they need, to get referred off to the suitable things, and maybe talk to people about what they've learned in the workshop. You can't actually teach people how to do that. You're not qualified to do that just from doing this workshop, but you can learn a lot that will give you more understanding of just how anxious the animals you might be working with. You'll be able to say to the people, hey, I've done this workshop, and from what I've learned, I can see that your dog's got anxiety issues, and the people might not even realize. So there's benefits on that level. Yeah. And understanding what it takes to really help an anxious dog, if you're a professional, means that then you can be part of a team of people that are helping the dog in a much more effective way.
Okay. And I guess the other thing is, like, no one likes to be told that their dog is anxious. Like, what's a good way to bring that
Well,
up?
I just tell them, I say, look, your dog's showing really clear signs of anxiety.
Yeah.
It's like I say to people, look, your dog's fat.
Yeah.
And that upsets people sometimes. Actually, I try
Yeah.
not to say, your dog's a little well padded, because I can be a little bit blunt with I'm kind of on the spectrum myself, and I can be a little bit like, you got a fat
Yeah.
dog. Dog needs, that's probably not the best bedside manner, but hey.
Yeah.
There are a few people here on the comments who are saying that someone's got a dog barking incessantly when they leave. That's a strong sign of separation anxiety. Another little Yorkie can't leave without him crying out. Yeah, so we've got quite a few people who've got anxious animals here with us, and I'm hoping you're all going to come to this workshop because we're going to have a stack of fun together.
What do you do with the dog that just? 'Cause I remember an ex-girlfriend of mine. She couldn't go anywhere without her dog just not but and he was the most he was a rescue dog, super calm when we were around, but she just could not leave, and he would just bark, bark, bark non-stop until we came home. like
Yeah.
how do you manage that?
Well, it's separation anxiety, and there's all different kinds of flavors of anxiety. There's all different kinds of things that individual animals perceive as being fearful and threatening and dangerous. For that particular dog, not having a human around makes them more afraid. Another dog, it might be the sound of fireworks that sends them absolutely crazy, or thunder. Another dog, it might be going to the vet. Another dog, it might be, so in a way, the triggers are important, but learning how to deal with the underlying problem of an animal that has learned to be afraid of something, which then triggers them into unhealthy arousal that they can't regulate back into relaxation from. So in day 2, we really build the treatment plan in the workshop. So we help you understand what the foundations that you need to do are, help you understand the history and how your pet's anxiety has developed, teach you that, it's a really good idea to journal what's going on with your pet, because then if you start writing everything down, you can see what's working, what isn't working, what's making things worse, what's making things better. There's a whole kind of history section there that you'll fill out. And let me keep going down here. There's a lot of pages in this manual for this workshop, I got to tell you. So keeping a pet anxiety journal, your self-care is really important to your pet's anxiety. If you're not keeping yourself happy and relaxed, then your pet's going to have trouble relaxing. And then we go into the building the actual treatment plan, working out. Excuse me, I'm going to sneeze.
While you sneeze, for those of you that have just jumped on, we're giving away a Dr. Edwards free CBD intensive program that he's created. That's for anyone, for the first person who signs up to the workshop before we end live today. So that's a freebie that we're going to be giving away. So that's something that we wanted to add as an extra bonus. But when you were creating the manual going in, how did you formulate it, and why is that really, really important for people to get really clear on the foundations and then the treatment plan?
Well, you got to understand how anxiety works before you can treat it, and then you need a structured way to work out implementing different things, seeing if they actually work, seeing if they don't work, all these kinds of things. It's really important. And just to mention that intensive CBD workshop is a 2-hour session where I go into how you can use CBD not only for anxiety but for all sorts of different kinds of health conditions in pets. And if you're here and if you grab your seat in the workshop before this live ends, then you're going to get that, which is another $97 something value. It's a really good workshop. It's got lots of high-level information in it, but we just want to give you another little sweetener to come and inspire you to come and join us. And day 2 is where we really get into, working out how to select the right people to help your pets. And then we get into the actual treatment plan, which there's the 4 M's, which is kind of like the classical way that all vets will work with an anxious animal, but we're really leaning into the holistic side of things. We're trying to make it all holistic, try everything holistic first, and then only escalate to prescription medication if the holistic type things we're doing aren't the right thing. And you do get some animals that you get the best outcomes with prescription medications, but they're definitely not my go-to. They're like, okay, we'll try all these things, nothing else is working. Well, we'll see this and see if it works and see if it helps the animal be happier. So you've got the first M is environmental management. This is where we teach you how to work out what the triggers are and how to minimize exposure. Then we have behavior modification. So positive reinforcement training, counter conditioning, desensitization, and of course the therapeutic touch, which is the key way that I do that. Medication, and in medication I include all the holistic supplements and interventions and flower essences and energy healing, animal communication, alternative complementary medicine, herbal medicines, and then we get into understanding prescription medications and when they might be actually the best thing, dietary changes, supplements, all that sort of stuff. And then the final M is monitoring, evaluating and modifying what you're doing with your animals, because you do. It's an evolution. What your animal needs, your anxious animal needs over time tends to change a little bit. Maybe some things will stop working and maybe you need to bring some new things in. Maybe you're going really well and things are improving and then something unexpected happened that sets your dog back a bit. So you've got to reset and maybe go back to older things that you needed at different stages of the whole journey.
And I guess that's when, if you don't measure your success or track it's really hard to pinpoint, what's working, what isn't working, or even, going back to, it's like, hold on, my animal was really calm. What was I doing? And that's the whole point of journaling.
All those things. They're really, really important.
Anyone that has any questions, that want to know a little bit more about the workshop, or they want to ask Dr. Edward, now's your time to ask. We got someone that shares a question about tick and flea medication. I don't know if you can go into
We
that.
can't. It's really a bit off topic for today, though. I would not use isoxazoline type drugs. I think they've got quite a lot of potential for harm. And if you've got an anxious animal, a lot of these flea and tick medications can cause seizures, and that does affect the neurology. So yeah, you need to be careful, but you also need to do a risk benefit. Here in Australia, there's a lot of places that have a lot of paralysis ticks, and they'll kill your dog dead. So you need to also balance out the risk benefit for all of these things. We've got who's there? Soul Centre Healing. My little Shih Tzu barks at everyone when we're out walking at home. At anyone who walks past the house, that's an anxiety. That's not healthy. And if you work out how to do some things to fix that, you'll have a happier dog. Itching, again, that's a bit off topic.
But does if an itchy dog, if a dog has severe allergies, can that cause, or maybe that's a misdiagnosis? Someone's thinking, "Hey, my dog's anxious," but it's actually in pain. I guess that's why when you one of your specialties is silent pain.
Well, yeah, any kind of chronic itchiness is going to exacerbate anxiety.
Yeah.
Any kind of inflammation is going to make anxiety worse. Any kind of pain is going to make anxiety worse. And often anxiety will then make the pain worse too. So that's another thing that we're going to cover in this whole workshop, is the fact that you need to make sure that you're working with a vet and making sure there's not any underlying conditions that might be causing problems. Sabrina says, I'm a Reiki healer. Would that help my dog? It may. It's certainly one of the complementary alternative things that I recommend. Yeah.
Do you want to go into a little bit more deeper about why Reiki is in a short?
Well, I use intuitive animal communication type stuff in my work, and I do energy healing, but I use the energy healing which I've developed and teach, which is the whole energy body balance method.
Yeah.
I did study Reiki way back in the day. I don't tend to use it anymore, but all of these kind of subtle energy healing modalities, depending on your level of skill, can be really helpful.
What's the difference? Yeah.
What's the difference? Well, Reiki has a different quality and vibration of energy and different types of ways of applying and using that energy than what I do.
Okay. And what is the difference between what you do? If it's just...
Well, just what I said, really. I can't really explain it any better than that. It's a bit like, I suppose, maybe you go out to a restaurant and one person likes a red wine, another person likes a white wine. It's a bit like that. They're kind of similar, but they're not the same, and they have slightly different ways of connecting with and working with the animals.
Yeah. Okay. Well, I know you have another call after this, so it's 7:20 past my time. For anyone that has any questions, please make sure that you can ask now. We've got Julie here. Does Spain early? Sorry. This question here.
So that's an interesting question, and I'm not sure if spaying early has got a link to increased anxiety or not. I mean, it depends. Sometimes any kind of surgical intervention can be a trigger for anxiety for a given animal, and if they happen to have the surgery at a developmental stage when they're going through a bit more of a kind of one of those kind of what they might call fear periods, then perhaps the surgery would impact on them in a worse way. Certainly the lack of hormones doesn't help, and you can use the supralorin implants and things like that after desexing. That can help. I'm not sure though if that actually deals with the luteinizing hormone type thing, but yeah, desexing, the later you can do it, the better, and it's a difficult one.
And we got another question.
Have I have a 2-year-old. TT is calm and has no separation anxiety. She's very excitable when meeting new people and other dogs. So, dogs that get overexcited, if your dog gets overexcited and then is unable to respond to you asking them not to jump on people and stuff like that, that is actually a form of anxiety. And it does tend to get worse over time if you don't actually do something about it, in my experience.
Is that a training thing? Like when, like, to let them know?
Partially
Yeah.
training, partially reducing the opportunity. I tell people to put their dog on a lead when people come to visit so they don't have the liberty to jump all over everybody. But the biggest thing is teaching them how to regulate, teaching them so that they can learn how to calm themselves even in the face of exciting things and not be crazy.
I think that's a big one, is learning, like getting them to self-regulate, to calm down, and they get all hypo, and then it's like, okay, it's okay, and then they realize where they're at.
Just got someone here, Karen. All right, we got another one back a little further. My 3-year-old pit bull lunges, bites at people that he knows when they start to leave my house. He starts by whining. I've learned to see the trigger and I take him out of the room. I cannot figure out how to work with him. He does not do this behavior with me and my husband. So this is another animal with anxiety. And, I would encourage you to come along to the workshop because you'll learn a whole lot of things that you can apply to help this dog not get crazy. I mean, the thing that triggers your dog is that he gets anxious when someone's going to leave. And that's a hard thing. Now, Julie says, thank you. She's very stubborn, but I'm working with her. Now, stubborn is one word that I will not use when I'm talking about dogs, because stubborn implies the dog is deliberately not doing something. There's this kind of implication in the word stubborn that it's a deliberate act, and it's not deliberate. If you've got a dog that's not doing what you want, they don't understand what you want, or they're too aroused and too anxious to be able to bring their consciousness to engage to do what you're asking them to do. So they're not stubborn. They don't understand, and they're determined. If you think of your dog being determined, you're going to relate very differently to them than if you think they're stubborn.
Yeah,
Pop the
I'm
links
just
in. Karen's
laughing.
going to sign up. Just pop the links in
So
again for everybody.
stubborn is a great word to describe that, because I definitely know quite a lot of stubborn dogs.
Well, yeah, but they're not actually stubborn. I mean, if you look at the definition of stubborn, it's showing dogged determination not to change one's attitude or position on something, in spite of good arguments or reasons to do so. And this is not, your dogs are not doing this. They're determined, they're lacking in understanding, and often they're dysregulated so that they can't actually relax and learn and respond to your communication. Kathy's saying everything I've tried doesn't seem to help. Could this be anxiety that has progress? Absolutely. And, come and join us. Come and join us at the workshop. We're going to have so much fun.
All right, everybody. This we've come to a wrap now. Thank you so much for your time, Dr. Edward. Again, we start Sunday Australian time, Saturday US time. Going to be a 2-day, 4 hours each day, going really deep into the foundations, understanding the foundations, and then day 2 is creating the really clear roadmap for success. And then what we have understood, like any type of training program, sometimes there's a lot of information and you've just got the tip of the iceberg. So what Dr. Edwards also offered to do is that we're going to do a 3-week catch up after the workshop to help everyone make sure what they're doing to stay on track. So that's just an extra bonus that Dr. Edwards is wanting to give to everybody that signs up for this workshop. And today we're also giving away the CBD intensive workshop, which is that Dr. Edward has created. Thank you so much for everybody. Dr. Edward, thank you so much for your time.
Yeah, and look, if you're thinking of joining up and you haven't, jump on the link now, because you'll get that extra bonus training about CBD if you enroll on while we're still live on this call. That's the secret here for that one. Those who move quickly get rewards.
Exactly. All right. Thank you, everybody.
Thanks, everyone. See you all in the workshop.